Good morning, everyone around the world. We have participants from different continents this morning. It's both a great pleasure and an honor to share some ideas, thoughts, and results about the corona epidemic and its impact on migration this morning. And you have a chat function where you can raise issues and questions that we will try to answer at the end of after the end of the lecture. And so let me just walk you through a presentation, some slides that should, give you an idea what we are dealing with and what we are talking about. Let's start with some facts and figures. The number of officially confirmed cases is beyond 4 million globally, and we have 1.5 million people who have recovered or who have been tested but have shown no symptoms. And we probably will reach 300,000 people who have died from the virus as of today, which means that we have a mortality rate which is around 7%. So 7% of the confirmed cases with the death of the person involved. And it's higher in some countries, lower in other countries. There's variation among countries when it comes to death. But we also have to understand that there is probably many more people infected who have not been tested. So I just want to put this in perspective with other epidemics that we had in the past. About 15 years ago, we had the severe acute respiratory syndrome called SARS, basically in East Asia, with 774 people dying. More recently, we had the Middle Eastern respiratory syndrome during the last 6-7 years, where less than 900 people have died so far. Now we have the COVID-19, also called corona epidemic, which has cost us about 300,000 lives globally so far since the 1st of January, so within the last 4.5 months. We have had HIV/AIDS since the 1980s, so this is over the last 40 years, which has taken a death toll between 32 and 35 million people altogether. And when you go back in history, about 100 years ago, we had a devastating Spanish flu, which took the lives of approximately 50 million people, but the death toll could also have been higher. It is assumed that at that time, about 500 million people got infected globally out of a population at that time that was only 3 billion people globally. But let's not forget that tuberculosis is taking a death toll of about 1.5 million people each year. And this can be said about other infectious diseases. Think of malaria. Now, when you see the rate of infection is the highest in Europe, Western Europe, Southern Europe, and in the United States of America. When we look at infections per 1 million people, we're above 5,000 per 1 million. But we also have high infection rates in Turkey, in the Gulf states, in Iran, and increasingly also on the western side of Latin America. And within other countries of the Prague Process, we see Belarus, Moldova, Russia picking up. So that's all confirmed cases, including those people who have died and people who have recovered. Now, when you look at the more recent developments, you see where is the infection more quickly picking up. This is daily confirmed cases. We see the Gulf states, we see Belarus, we see Russia, we see the United Kingdom, still the US and the western part of Latin America, and we see now a few African countries picking up. including South Africa, Gabon, Ghana. When you look at death, you see that the registered death so far per 1 million people, per 1 million inhabitants has been highest in Southern Europe, the UK, Belgium, followed by France, Sweden, and the United States and Canada, but also Iran, and much less so in other countries belonging to the Prague Process. But we should not forget that not all people dying with or from a coronavirus infection are registered properly, because you need to be tested before you die. If otherwise you do not enter the statistics as coronavirus casualty or fatality. So let's start looking at effects on migration. And I would like to start with short-term effects on labor migrants, so-called expats, and also business travelers. And there you can see that the travel restriction and travel bans that we have seen are heavily impacting migration and return of these people. In late April, we had 167 countries and territories in the world out of the 210 that the UN is counting that had fully or partially closed their borders. This is 93% of the world population living in these 167 countries, a serious travel restriction. And out of these 93%, 39%, so almost 40% of the world population were living at the end of April and in early May in a country that had completely closed its borders to non-citizens and non-residents. This is data from Frontex about what kind of measures had been taken. So whether it's restricted or totally closed, you see a few differences among EU countries. You see almost no differences among Western Balkan countries, where almost everything, with the exception of shipping, has been interdicted or shut or closed. Now, there is certain groups of people who are affected by these lockdowns and by also the travel restrictions, working both in the same way, immobilizing them. And a forgotten group of labor migrants, often forgotten group of labor migrants, is people working on cruise ships. Now, there is no cruise ship active anymore on at the high seas, but there is still about 100,000 members of cruise ship crews who are still on board of these ships and who cannot leave these ships for the moment. We have plenty of labor migrants who are somehow caught in the middle because the country where they reside would like to get rid of them because maybe their jobs have disappeared or they are perceived as a risk. And at the same time, the countries where they come from are often reluctant to take them back because they have travel restrictions themselves. Then we have sex workers. So all the facilities are closed for the moment. In many parts of Europe, sex workers are foreign workers, and it's the same situation that they are trapped here. And then we have plenty of caregivers in private homes who are foreigners in the place where they work, and they also cannot go home and can also not be replaced by new ones as long as we have travel restrictions. Now, whether you have a chance of being repatriated or not does not only depend on the measures taken by the country where you temporarily reside or where you have traveled to, but also by the question whether your own home government is taking measures to repatriate you. And you see that For example, Germany has already repatriated more than 330,000 people in March and April 2020 with about 150 flights. We have seen that France, the 23 of these flights, the Czech Republic 13, Lithuania 2, Latvia 1. But for example, there have been no flights to Romania, to Bulgaria, to Ukraine. So these countries could only repatriate people who just got trapped on the other side of the common border with another country. So this is a geography of recent repatriation flights. And you see that European countries have been reaching out to all parts of the globe when it comes to repatriation of migrants and business travelers and also tourists. By the same token, on the other side of borders, you have people who have a work contract, who would have a place to migrate to, but who cannot reach the destination country because borders are closed and travel restrictions are imposed. And in many instances, there's no trains, there's no flights. So even if the border would be open, there would be no means of transport. So then we have not anticipated or unexpected return movements. For example, there's domestic workers, for example, in the Gulf states, where who are being sent back or who would like to get repatriated because the Gulf states have a high infection rate. So maybe they're also afraid of staying there. But to a certain degree, then the sending countries where they come from are reluctant to take them back, or there's no travel connection currently. We have seen reverse migration flows, people leaving Afghanistan to Iran maybe a year or 2 or 3 years ago, but now trying to go back. So what you see on the picture is Afghan nationals who try to go back to Afghanistan, a movement we have not seen on a voluntary base recently. Then we have seen Venezuelan refugees in Colombia who are trying to get back to Venezuela, for example. And we have seen, here's a picture of Tajik construction workers in Russia. So if the construction site is closed, these labor migrants would like to go back to Tajikistan during the time when they have no employment and no income in Russia. Now, let's take a short look on the effects on irregular migrants and asylum seekers. In Europe, you see 57 states currently do not accept requests for asylum, according to UNHCR, which is about 25% of the international community on the basis of sovereign states. We have much fewer irregular flows across the Mediterranean and in a few other places in the world. In many cases where asylum seekers or irregular migrants have been confined, the detention is suspended, but there's also a total suspension of deportation and repatriation efforts that we are seeing here. I give you here the figures of weekly arrivals from Turkey to Greece, Cyprus, and Italy. So that's mainly Syrian citizens, Afghan citizens, but also Iraqis, Iranians, a few African citizens trying to reach Europe via land or via sea from Turkey. And what you see here is that in recent weeks, there have been almost no arrivals, close to zero arrivals. This is the border between Croatia and Slovenia. What you see normally in the spring is an increase. When you look back to last year, what you see this spring is that there's absolutely no increase in the number of irregular border crossings from Croatia into Slovenia. This is the number of people arriving in Hungary. You see, this is the lowest number in recent month. Last time it has been so low was in the spring of 2017. So this is just 3 examples that show an immediate effect also on asylum. This is the yellow line here, gives you the amount of restrictive measures and border closures that we are having. And the blue line gives you the weekly asylum applications in Europe. And you see a reduction of about 85% compared to the first 2 months of 2020. So compared to the beginning of the year, the number of people asking for asylum in Europe is 85% lower today than it was 3 months ago. Now, let's take a quick look at remittances. So the interesting thing is that we also know from historical examples in the past is that when you have a crisis in the place where people are coming from, then usually remittances are going up. And what we see here is that the remittances between the US and Mexico, according to data collected by Bloomberg, have been going up in recent weeks, just as it would be expected. But unlike in other times of crisis, now we have a special case because the coronavirus 19 infection and the lockdown that leads to economic recession and unemployment hits both sending and receiving countries at the same time. And so we will see to what extent this time will be different. What we already see that some remittances are delayed following the closure of branches of remittance providers like Western Union or MoneyGram and others. People could just not walk into a shop and send remittances. And there is also long-term effects on labor migration that I would like to discuss shortly with you. So now we are entering the territory of guesstimates and speculation. What we know for sure is that 2 years ago, in the year 2017, the International Labour Organization, ILO, was assuming that there would be 164 million working migrants, so people economically active and living outside their country of birth. So this is the definition of a migrant in the world globally, with about a third living and working in Europe, and about a seventh or an eighth in Asia and in the Gulf states, and in some other Arab countries, and about a quarter in the US and Canada, so in North America here. Now, when we ask ourselves, what is the impact of the measures taken to fight the infection, leading to an economic recession, on the short-term liquidity of certain branches and industries, and on the profitability? And both things can lead to the insolvency of a company, both if you have no cash anymore on your accounts, or if your business turns out to be non-profitable for a longer period of time, which will also then translate into a cash problem. And we see this area is highly affected. It's many retail businesses outside the food industry. It's airlines, but also cruise ships. We have already seen a picture of a cruise ship here. It's other forms of travel and tourism, hotels, restaurants, etc. These are the most affected industries. And at the same time, these are also industries where in many countries there is a high percentage of foreign workers employed. So airlines employ many foreign workers by the very nature of their business in tourism and travel, in many retail businesses. Same is true in the automotive sector. In Western Europe, many automotive workers are foreign workers. The same is true for construction, but the construction business seems to be much safer. Many construction sites have not closed even during the lockdown and are continuing employing foreign workers. So this is a first assessment, which industries could be hit most and where migrant workers could be more or less affected here. So migrant workers in heavily affected sectors getting unemployed in destination countries, or if they cannot move to a new job abroad to which they would have been assigned, remain underemployed in sending countries because of recruitment stops. So the examples are, as we have said, tourism, restaurants, car production, airline, cruise ships, local transport as well. In many countries, taxi drivers, Uber drivers, private bus services depend on migrant workers. The other effect is that low-skilled migrant workers are displaced by the crisis because digitalization takes place, the spread of home office use. So for example, retail sales forces could be replaced by online orders. Facility management becomes unnecessary, or cleaning when offices are not reopened and people stay at home, and usually they would not employ a foreign worker to clean to the same extent as their company would do it. This is a calculation that the Joint Research Center of the European Union has been doing. We give you data on the airline impact. So the blue line here is the impact on passenger traffic of the Middle Eastern respiratory syndrome. 5-6 years ago here, we had a loss of a bit more than 10% of airline traffic at the beginning of this epidemic. And again, I wanted to remind you, less than 1,000 people have died from the Middle Eastern respiratory syndrome. About 20 years ago, we had this severe acute respiratory syndrome, basically in Eastern and Southeastern Asia. And what you see here is the red line is a drop of about 40% of airline passengers. So this is MERS, this is SARS, severe acute respiratory syndrome. And this is the coronavirus effect that we are already seeing with different scenarios, how long it might take. So we have lost about 90% of air traffic over the last 3 to 4 months compared to where we were at the beginning of the year. And this has an impact for people working in airlines, on airports, but it also has an effect on people who are depending on business travelers and tourists coming to their place. And it impedes migrant workers waiting to take up a new job somewhere else or waiting to go back home if there is no flight connection. Let me quickly give you an idea about educational perspectives. What we know from the European Union is that non-citizens in school, about 25% of non-citizens in schools are ending their educational career without formally finishing it. So we call this early school dropouts, which means you're reaching age 15 or age 18. So you're no longer, there's no longer compulsory school attending, but at the same time, you have not graduated from the last class as supposed, as compared to only 10% of the nationals in the European Union having the same problem, being in the same situation. So about 25% of children with migrant background do not properly graduate from European schools. And this can be because of language issues. It can be because they have entered schooling too late because they came with their parents, or some came as unattended minors. There's various reasons for this, or their parents cannot help them at home because they don't speak the language either. Now, what we see during the coronavirus virus crisis is that in many countries, in most countries of the globe, schools have been closed. There is only 3 confirmed exceptions, which is Nicaragua, Belarus, and Taiwan, where schools have been kept open throughout the corona crisis so far. And now we have the following problem. According to modeling that we have been doing at the Joint Research Center, you can see that reopening schools is more risky than only reopening work sites or to only reopening leisure activities, because children have the same risk of getting infected, but most children don't develop any syndromes and any symptoms, and so they cannot easily be isolated. And so the risk that children are spreading the virus because they infect each other at school and then bring it back home to their parents and grandparents is much higher than other risks that might be for adults. Now, we have the problem that on the one side, children with migrant background already have difficulties in normal times. In lockdown times, there's a high risk that these children with migrant background will lose even more the possibility to integrate into educational systems and to finish their curricula in a proper way and successfully. At the same time, reopening schools is more risky than other measures when it comes to spreading the virus. Let me finish by just saying that in current times, also the contribution of migrant workers to the economy is becoming more apparent when these people cannot travel and are not reaching their destination countries and their jobs in destination countries. We have a high dependence on migrant workers in many countries on construction sites. So from Lisbon to Moscow, we have many migrant workers working in meat processing and meat packaging. There is plenty of migrant workers working in agricultural business. And in many countries also, there is many healthcare workers who come from a different country. And so when you look at these key workers, you see that on average in Europe, 13% of the key workers are foreign born. So according to our statistics, about 1/3 of all workers can be defined as key workers, which are essential to keep an economy and a society running, indispensable in that sense. And many of these functions have not been closed down even during the lockdowns, like hospitals remaining open, food retail stores remaining open, agricultural production remaining open. And now we see how dependent we are on migrant workers in these businesses. And some countries where it's much less the case when you look at Romania or Poland or Bulgaria. So Central and Eastern and Southeastern European countries. But when you look at places like Germany, Austria, Sweden, Ireland, or Luxembourg, there's a heavy dependence here. And so the corona crisis, lockdown, and travel restrictions are a reminder of these issues. So this is the key workers born in the EU, so they are mobile between EU countries. This is the key workers born outside the EU and coming from a non-EU country. But travel restrictions exist today between EU countries as well as between the EU and non-EU countries. So the effect is almost the same. You see where they are working. So cleaners and helpers have the highest percentage of foreign-born workers. Mining, personal care, food processing, drivers, personal service workers, but also ICT workers, health professionals, to give you the full range here. This brings me to the end of this lecture. Thank you so much for having attended.